We will briefly talk about some cardiac pathologies. The first one that we're going to discuss here is going to be a hypertension. So essentially it's a blood pressure, high blood pressure. Okay. So hypertension often goes without the symptoms. The key risk that comes from hypertension is the stroke, the either stoppage of blood flow into a certain part of the brain or spillage of blood into a certain part of the brain. It is defined as systolic pressure being above 140 and diastolic being above 90 millimeters of mercury. So the main risk factors for hypertension, as for many other cardiovascular diseases, is smoking, obesity, sedentary lifestyle. There is a strong contribution from genetic factors. People with hypertension often develop edema, swelling in the peripheral tissues like the limbs. The main interventions that can reduce the risk for hypertension: dietary, less processed foods, processed carbohydrates, reduce amount of salt, exercise, reduce smoking and drinking, and there are of course medications from beta blockers and calcium channels blockers to diuretics. A really big problem in cardiovascular disease is atherosclerosis. So in atherosclerosis, here you see a normal artery, and here you have an artery with atherosclerotic plaque. You see that a significant chunk of arterial space is occupied by the plaque, and arterial lumen is much smaller in atherosclerotic artery than in the normal artery. So if this clot reduces blood flow, it reduces oxygenation of certain tissues. If atherosclerosis is in the heart, is in the coronary vessels, that reduces the blood flow to the cardiac muscle. If atherosclerosis develops in the cerebral arteries, it reduces blood flow to different parts of the brain, and that may be detrimental for that particular tissue. In some cases, people can develop a clot. It can be attached to the vessel wall. Essentially, atherosclerosis increases the chances for such outcome. So thrombus is a clot. It is attached to the vessel wall, and in the unfortunate case of a clot that is ruptured, or atherosclerotic plaque that is ruptured, this loose plaque or loose thrombus can actually block the blood flow through the vessel, and that leads to tissue being hypoxic beyond the point of blockage and essentially dying. Now, one of the big problems associated with the cerebral circulation, not only cerebral but cerebral as well, so-called aneurysm. So here you can see the aneurysm. This is the aneurysm as well. Elevated blood pressure may lead to the blood vessel ballooning, much like the hose, which is used improperly with very high pressure of fluid running through the hose. Its walls can weaken. So if aneurysm bursts, it's usually fatal. If that aneurysm bursts in the brain, that leads to so-called hemorrhagic stroke. Okay, and in case of hemorrhagic stroke, patients often die because basically too much blood is being lost through that rupture of the aneurysm. If aneurysm is found, say, in the aorta, okay, somewhere in the abdomen, you can imagine that rupture of the aneurysm in the aorta leads to very quick bleeding and loss of massive amount of blood from the circulation, and that is, of course, detrimental if the patient cannot receive the immediate medical care. Another type of the stroke actually is ischemic stroke, shown here in this case. You see the embolus, that thrombus, blocking the blood flow. Loss of blood flow to a specific part of the brain causes the death of neurons, and basically death of that part of the brain, and this damage is unfortunately permanent because neurons, as you remember, do not divide. Ischemia in general refers to the loss of blood flow to a certain part of the body, and ischemic stroke essentially refers to the loss of blood flow to a certain part of the brain. So some of the symptoms of stroke are problems with the speaking, blindness, numbness of one side of the body, paralysis of one side of the body, and they can kill people. Now, myocardial infarction and angina. So what is that? So this is the blood vessel, coronary blood vessel, like, interventricular coronary artery or right or left coronary artery. So what happens is a plaque, mostly it's plaque here, okay? Plaque ruptures and occludes the blood flow, blocks the blood flow through, say, this particular blood vessel. So the portion of the cardiac muscle beyond that occlusion dies. That's essentially it. Portion of the muscle dies. It can be caused by thrombus, by atherosclerotic plaque, imbalance between the supply and demand, vasospasm. Usually it's the plaque rupture or atherosclerosis. Now, what's angina? So angina is a pain, cardiac pain, that results not from permanent occlusion, but from temporary loss of oxygen supply to a certain part of the heart. So basically what happens, let's say there is an imbalance between the supply and demand, so blood vessels are narrowed down, or there is atherosclerosis that decreases the size of the lumen. So when you exercise, blood flow does not comply with the demand of your cardiac muscle. What can you do about it? Do less strenuous activity. Check your heart. Stable angina is a condition which occurs every time you perform a strenuous activity. It is a sign, that signal for you that there's maybe a problem with the coronary blood vessels. Unstable angina is much worse, because if it happens without any underlying reasons, if it happens without any strenuous activity, it means that your blood vessels, even when you are at rest, do not provide enough blood flow to your cardiac muscle, and that is the predictive sign for the future heart attack. Now, what are the treatments for angina? Because when it's heart attack, it's a bit too late. So treatments for angina include balloon angioplasty, introduction of a stent or bypass. Or, you can do drugs, but we'll get there. So what's the balloon angioplasty? Here you see the balloon is inserted into the site with atherosclerotic plaque. It is inflated, which flattens the plaque and increases the blood flow. Okay. Second option is the stent, where the stent is introduced in the blood vessel. You see the stent introduction in the upper right picture. This is the stent in the blood vessel. It is inserted into blood vessel, and it's like a little coil. When it's left there, it opens up, essentially widening the blood vessel. Or if atherosclerotic obstruction is irreparable for some reason, the stent, the bypass surgery may be chosen, so the fragment of basically a blood vessel from that same person, another blood vessel, piece of blood vessel, is introduced as the bypass. Okay, you can see it here. And the fourth option, of course, if damage is irreparable, artificial heart or heart transplant. Now, the last couple of conditions that we're going to talk about, the congestive heart failure and varicose veins. So congestive heart failure, you see here, the left and the right, two hearts with a cardiomyopathy. Left, you have non-dilated cardiomyopathy. The cardiac muscle becomes too thick on the left side, so the volume of the ventricle decreases. And on the right side, here, you can see very much dilated left ventricle, and the cardiac muscle just cannot contract efficiently when it's that much stretched. So essentially, if left side fails to pump the blood efficiently, blood starts to back up in the opposite circuit. So if left side fails to pump efficiently into systemic circuit, blood backups in the pulmonary circuit. That leads to pulmonary congestion and pulmonary edema. If right side fails to pump in the pulmonary circuit, then fluid will back up in the systemic circuit, leading to the peripheral edema. And lastly, varicose veins, shown here. Okay, that's normal vein. It's the varicose vein. Usually it's the result of elevated blood pressure, sedentary lifestyle, when blood backs up near the venular valves here. And that blood leads to the expansion, permanent stretch of the venular wall, and this very unhealthy looking appearance of this varicose vein. So basically, blood also more successfully pools in those varicose veins and increases the probability of the clot formation in the varicose veins. That's going to be it for the pathologies of the cardiovascular system, and we're going to be talking in sort of the next chapter about blood itself.